We're going to take you live back now to Sydney, where New South Wales Chief Medical Officer Dr Kerry Chant is giving a coronavirus update.
Including Aspen as well as other health providers to ensure that we do everything we can to keep residents safe.
There was a real risk for other residents there. I mean, 2 days ago, residents were testing positive. Again, this is nearly 3 weeks, it's 3 weeks today exactly, but 2 days ago, that was the issue. If one of those people die and there are 40% chance of passing away, I mean, someone has literally, excuse the phrase, but blood on their hands, because, I mean, this has dragged on for so long. There are many, many families there very distressed by what's going on.
I think this highlights challenges within an aged care facility when you have a large number of residents that are potentially exposed, and it also emphasises the importance of the messages we've been giving from the beginning. That, you know, the key learnings here is that we have to get on top of these infectious disease outbreaks at the earliest possible stage. So we know that from some other experience we've had with aged care, if the healthcare workers are very vigilant with symptoms, and as soon as symptoms present, we can get them tested. And I understand the challenges. This is not about a blame game. It is really hard when we're dealing with a virus that can cause incredibly minimal symptoms. But that's a key lesson, because we know that if we get in early in aged care, it's much easier to know who's infected, who's not.
Are they sitting ducks? Should they move the ones that don't have it? Should they be moved down?
So some of the challenges is that even at the earliest stage, even if you had have moved out people you thought were negative, you would have got it wrong, and you would have put a number of negative people together with positive people. So look, there are a number of challenges, and we will be considering all options every day. The Commonwealth, the state, the Anglicare, infectious disease specialists sit down and look at the plan. And it's complex. We've got to think about what are the risks and benefits of every aspect of that, and put the residents at the centre of any decision making.
I think we spoke and you said that there'd been no, it had only been primary transmission from the original source. I presume you're now looking at...
We're looking at secondary cases, and we've clearly seen transmission that on the surface looks like there's been breaches in infection control amongst particularly the staff, and that's of obviously concern.
What sort of breaches are you talking about?
So basically we know, and you've seen other healthcare outbreaks, and you as the media have reported on other healthcare outbreaks. It requires meticulous, consistent adherence to processes to ensure that you don't get transmission. You know, the process of everyone wants to wear a face mask, but it's not just simple about a mask. It's about putting the gown, gloves on and taking it off. So often your greatest risk is if you take it off. Getting it on, you have less problems, but you've got to take it off in a particular order to make sure that you don't contaminate your hands and other things. So there is a lot of requirement to be doing things consistently, to be very careful when you're donning and doffing PPE, and meticulous in a lot of aspects of infection control. And though that's obviously the aspect of the focus of yesterday's visit to the aged care facility, where we had 2 very senior infection control practitioners, one of them who's on the national committee that has drafted the aged care guidelines, to re-look at anything that we could find out in terms of strengthening the procedures. And a number of things have been demonstrated.
What issues did they highlight in their report?
So they're actually compiling that report, but in terms of the verbal feedback, there are opportunities to strengthen. As I said, it's about this consistency. We often know that we need people present to watch people, to ensure that, and remind people to ensure that you're doing things systematically.
Okay, that's where we're going to leave that press conference. That's Dr Kerry Chant, the New South Wales Chief Medical Officer.